no matter where you're coming from, when you start that first job, I feel like there's no educational component about how to be a consumer of healthcare.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefits systems. I'm Jolene Myers.
And I'm Sarah Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people.
Welcome, listeners. We are so happy to have Jerame back on the podcast today. This episode marks his third appearance here. We keep inviting him back because he knows so much and he's great to talk to. Jerame has more than 15 years of experience with benefit administration and management. Another fun fact, he dedicates a portion of his free time volunteering to help those entering the job market by participating in a program called Workplace Readiness. We're thankful he's spending a little time with us today. Welcome back, Jerame.
Well, thank you very much.
Yeah, we are so glad to have you. So thinking about what you do outside of work with Workplace Readiness Program.
Yep.
We thought one of the things that you might be able to talk to us about is kind of the general concept of workplace readiness. And in general, getting your first job that has benefits. I feel like that's a whole separate learning. So when you get your first job that offers medical benefits, where would you advise someone even start to try to understand what it is that they're getting?
That's actually a fantastic question. This has come up a handful of times through all the different iterations of the workplace readiness that I've been a part of. And I actually send people in the direction of calling the customer service, which goes by obviously various different names within the in carriers, whatever the carrier's customer service department is. So, for example, there's somebody that had a different carrier than us and had some questions as related to just going to the doctor. Had no idea what in-network was, to be completely honest, because one of the individuals that I was working with was from out of the country, so they were not familiar with our own healthcare system. So they didn't understand what in-network was, what out-of-network was. Using the term provider wasn't something that they were even familiar with. It was just, listen, if I'm sick, where do I go and how do I talk to someone, so on and so forth. So I had directed them there, and of course, being familiar with it from our side, it was easy to sort of hand that information to someone and kind of navigate their direction, where I think it's challenging even for people in our own country that are, new and getting into jobs for the first time. They don't know the difference between insurance. I mean, in my own life, in my own circles, talking to younger people that are getting into the workforce, insurance doesn't mean a lot to them because they've always been a part of a different plan. They just showed up and paid a certain amount. At the end of the day, it can be really confusing when you find out, that there's sometimes a liability. Sometimes when you talk about something like a cost share, it blows people's minds. So really, when it comes down to it, I think your greatest asset, is going to end up being the customer service of that particular carrier and asking the questions that you have and hoping, obviously, like we do at ours, that you have an open mind and an open heart to help people and understand where they're coming from. If they're coming from a place of ignorance, and I don't mean that in a negative way, they're just not familiar with things, that you understand that and you work with them on trying to sort of close those gaps in their mind and make them feel comfortable about the direction they're going to go in.
I feel like that's it. No matter where you're coming from, when you start that first job, I feel like there just is not there's no educational component about how to be a consumer of healthcare. So you're looking at your benefit plan and it's using terminology that you don't use in your daily life, and the difference between copay and deductible and out-of-pocket maximum and out-of-network and out-of-area, and all of these things are things that you probably don't even worry a whole heck of a lot about until you need them.
100%.
And that's not really a great time to be learning things.
No, I completely agree.
I'm not dogging home economics. I don't even know if that's still a thing. I'm 40 years old. Is that still a thing? I don't know. But, maybe we should start. Maybe you should start, teaching some common sense stuff and stuff that students are actually going to need in their real life. For some reason, they do not teach that, and they should. It should be something in high school, something in college. I don't get it.
Yeah. I even trade school, I feel like would be something you could talk about. Most people obviously are not going to go to trade school for anything or many things that have to do with the healthcare industry. But even as part of any of that curriculum, if you're going to go for being an electrician, you're going to be going for plumbing. I mean, these are these pieces where even as sole proprietors, what does that look like? I know I should have coverage in case I electrocute myself, or I hit myself with a wrench, whatever that situation is, you should know, that otherwise you're all you're doing is going, hey, I'm going to go to the doctor. You show up, they're going to be like, do you have insurance? Yes, I'd love some of that. Well, no, you actually need insurance, like those sorts of things. So I completely agree. There's a giant gap in the knowledge of any age range.
Yeah.
Again, in my own circles, there is individuals that are ill or they're elderly, and they, sometimes they have no idea what to do. And it's not, some people, they don't hit the internet. Like they don't realize, especially the elderly are not familiar. They're not going to understand the Google. They're not going to be able to look up definitions, nor, those are the sorts of things where they just need someone to hold their hand. And, sometimes it's a simple explanation. It's 15 minutes and you're good to go. And other times they're going to need someone to navigate from here to whatever they need at the end.
Well, and now that in the US, you can be a dependent on your parents' health care until you're 26.
That's right.
I mean, no offense, 26-year-olds, but we're not talking about 18, right? You're in a different spot in your life. So you're even able to maybe navigate off in some instances later than when we all passed 18.
Absolutely.
But once you understand what your benefit plan is, then you can almost start to ask some better questions when you're at the doctor's office, I feel like, because now you're sort of asking those questions within the context of your plan as well. Not only what are the care options for me, but are there lower cost alternatives? Is there something I can do that's closer to home? Is there something for me that's better further away? And then what does that cost look like for me? Because it varies by plan.
Yeah, there's if you even consider things like sports injuries, people going, well, I understand I should have surgery, but when you go to the doctor, they may say, well, surgery may not be an option. Why don't we try therapy? And people are like, oh, I might have a therapy benefit. You kind of look and see what that looks like. There's a lot of different complicated pieces of the insurance game when it comes down to it. And to your point, if you become much more educated, there's some really great things that are in there too that you may not have even considered as part of your overall plan that, to keep yourself healthy or to get yourself healthy, all of which gigantic benefit when it comes down to it. But again, some of that legwork, if it'd be much better upfront than having to do it when you actually need it.
I'm trying to think of what doctor's office I was at recently, and they said, yeah, you need to come back for a checkup in a year. And I said, okay, well, that's not ideal because the time that we are in the year, like that's going to screw me up. So can we do this a little earlier in the year? And she said, no, your insurance plan is only once a year. So we'll make it then. And I said, how about we make it when I would like to make it? And I'll call the insurance company and just confirm. And she was like, well, she shouts to her friend, with this insurance, is it once a year or once per calendar year? So is it once a year from the day of service, which means your next appointment can be 366 days later, or is it once per calendar year? And the girl yells, it's once per calendar year. I said, I know, I work there. It's a question I've asked before. So that I feel like as a consumer, that's one of the frustrating things too. If you don't know that, you're listening to the people in front of you. And sometimes, because humans are humans, that might have been a policy a while back that it was once for 365 days. And so now it's not anymore. And that person at the front desk there doesn't know. It didn't make it to her. She's doing the best she can with 10,000 benefit plans in front of her. But a call to customer service then sort of clarified for me, yes, it's once per calendar year. So I feel like as a consumer, you get an answer and it's not always the right answer.
That's right. That's right. I mean, consider authorizations, right? So you have pre-authorizations, you have plans that are out there that are specific because, some employers have certain plans, and then there's other ones that have sort of a community type plan that are very similar. But, as it relates to like some Nova plans, like we're very unique. There are different plans that are really customized for the employer need and the demographic and things along those lines. And so you get into situations where you hear things and you don't know even what a pre-authorization is, right? And wait wait a minute, am I supposed to go to this rehab, or I'm supposed to go and get, this sort of service done, but I'm not even sure where to begin. And it says that I need to have an authorization. Like, who does that? Customer service, like we call ours care navigators. So the care navigators, and I think that's appropriate. Like when it comes down to, listen, we're going to listen to your story. Let's figure out how we're going to tie in your story to your benefit, and then we're going to put you in a direction. Depending on what it is, you might end up getting, a case manager. You may find out that all you needed to know is, yes, you need a pre-authorization, and your provider can, send it to this location. And so that is really the job of our care navigator. It really isn't supposed to be order taking. The idea is to hear it, to understand it, and then to serve the member, as a whole, and to anticipate what the future looks like. We talked about knee surgery. Do I have to get an authorization? Well, it looks like you do, but you should also know that sometimes there is like some sort of physical therapy afterwards that is coupled with this, and you are going to need some form of authorization, or it's numbered, just so you're allowed 20 visits, things along those lines. And that's what the care navigators do to try to help get people from A to Z.
Well, then if you know that up front, right, you're sort of planning differently. And I found a lot of physical therapists will say, well, here's the list of exercises. So if it's cost prohibitive,
that's right.
Here's how you can manage some of this at home, which I think is helpful.
For sure.
That was fantastic. Thank you. I feel like it's hard to start a first job. It's almost harder maybe to figure out your benefits with the first job.
Oh, yeah.
There's a lot thrown at you.
Oh, my gosh. Well, the first time I think I did it, I found what I thought was the least expensive plan. I had no idea what anything else was. It didn't matter. I saw, I think I took a plan because I happened to see a commercial once for it, and it was like a good commercial. So I was like, oh, I'll just choose this plan because it was such a nice commercial.
Marketing.
Didn't know what it meant, had no idea, right? Like it was just, I had no idea what I signed up for. I got this little card. What am I supposed to do with this card? Had a separate dental card. Like, what am I supposed to do with this card? Which one do I show when I go? It
depends on whether you're having oral surgery or not.
Right. And you get all these different things like, oh, awesome, I can have braces. No, you can't. Darn it. You get all these different things.
I think you would be an excellent professor at a college if they decide to roll this out.
You can lead the curriculum.
Start teaching some of our kids or our youth.
Yeah, I would. That's exactly what I love to do. If I can throw in a little coffee knowledge in there, so we can talk about insurance, and then we can talk about it over coffee.
We can talk about it over coffee. That's the only way to talk about insurance.
That's right.
It helps.
That's a great way to end this. Thank you for coming on, Jeremy. We appreciate it.
Oh, it's always my pleasure. Thank you.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR, the coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.